There are a lot of headlines right now in the panicverse about the link between Tylenol in pregnancy and autism or ADHD in kids. I have literally been debunking this link since 2014, so let's talk about it. This is a place where there's a really important distinction between what the data says and what the best data says. It is absolutely true that there are correlations between exposure to Tylenol, particularly at higher levels during pregnancy, and neurodevelopmental issues in kids. Those links are actually fairly small, maybe a 1% increase in the risk of one of these conditions, but they do show up pretty consistently. However, those are just correlations, and there are a lot of other differences across families that you cannot adjust for in the data, and researchers aren't able to control for. More recently, we have gotten some better data from sibling comparisons. Researchers who have enough data, it's based on 2.5 million births in Sweden, enough data to compare siblings where one of them was exposed to more Tylenol during pregnancy than another. And when they look at that, when they look within siblings, you see no difference in neurodevelopmental issues depending on Tylenol exposure or not. So let me say that again. In the best data, we do not see a link between Tylenol exposure during pregnancy and neurodevelopmental issues. And so if you feel like you need a Tylenol because you have a headache, because your hamstring hurts, because your knee hurts, for some other reason, you should feel comfortable taking it.